So a very good morning, all of you. So first of all, I'm I was associated with AIMS Delhi and NCI AIMS judges since last 7-8 years, but I have been the part of Hamlet the family just last week only. So my affiliation needs to be changed. So so thank you, Ratnam sir, for such a wonderful start for this epidemiology. So again, the next topic is hematopoiesis pathway and lymphoma pathogenesis. So the significance of the relevance of this topic lies in the fact that unless we understand our normal, how the normal blood cell develops, how the normal lymphoid cell differentiates and matures, we are not going to understand the abnormal. We are not able to diagnose, we are not able to classify the disease, and we are not able to treat the patients. That's why per se this topic is very important to understand our normals. So for the sake of understanding, I have divided the talk in two different parts. In the first part, we will be dealing with the hematopoiesis pathway. Yeah. So the learning objectives here will be the brief introduction to what hematopoiesis is, then the various phases of hematopoiesis, and finally the brief overview of the regulation of hematopoiesis. So not a big deal, as all of us know that hematopoiesis is the process of involvement of blood formation from the primitive progenitor cells, which is called as hematopoietic stem cells. So the phases of hematopoiesis, the hematopoiesis begins at day 7 to 8 of the embryonic life, and that in the yolk sac, and that is called as something called as the primitive hematopoiesis. So primitive hematopoiesis, it starts in the yolk sac with the formation of blood islands. The blood islands, it is composed of what we call as the primitive erythrocytes and primitive macrophages. After 2 to 3 days of this establishment of primitive hematopoiesis, the definitive hematopoiesis, it gets established in the anterior portion of our mesonephros, that is the AGM region, aorta, gonads, and mesonephros region. And from there, the definitive hematopoiesis starts, and by the mid-second week, it gets established. The process of this definitive hematopoiesis, it is taken over by liver, and by the end of third week, bone marrow, in the establishment of definitive hematopoiesis, it gets established in what we call as bone marrow, and from here onwards, the bone marrow takes over this entire process of definitive hematopoiesis, and it continues throughout our life. So hematopoiesis, as all of us know, it's a hierarchical process in which the hematopoietic stem cell, it lies at the apex of this hierarchy, and in the very initial stages of this hematopoietic stem cell, it differentiates into the CLP, which is common lymphoid progenitor, and CMP, which is common myeloid progenitor. Now, common lymphoid progenitor further differentiates into committed progenitors of primitive B and T cells, which ultimately, through various steps of maturation and differentiation, gets transformed into mature T and B lymphocytes, which we'll be discussing later. Then moving on to the common myeloid progenitors. Again, the common myeloid progenitors, as we can see here. So the common myeloid progenitors, it is again differentiate into MEP, which is megakaryocytic erythroid progenitors, and GMP, which is granulocytic monocytic progenitors. Now the MEP, it further differentiate into burst forming unit erythroid, and through the various this committed progenitor phase of BFE, which is burst forming unit erythroid, colony forming unit erythroid, it differentiate into proerythroblast, then early, intermediate, and late normoblast, and finally the mature erythroid cells. Similarly, the megakaryocytic colony-forming cells, it differentiates into megakaryocytes, and from which are platelets buds. Now moving on to this GMP, which is granulocyte monocytic progenitors, it further differentiate into the cells of eosinophilic lineage, granulocytic monocytic lineages, and mast cell lineages, and ultimately all of them, through the various steps of maturation and differentiation, differentiates into the terminally differentiated various cells of lineages like eosinophil, neutrophils, monocytes, basophils, and mast cells. Now, the developmental pathways of hematopoiesis. So there are various theories regarding this. So the earliest theory, which was prevailed over 4 decades, was the classical dichotomy theory, which tells that the hematopoietic stem cells in the very early phases of it differentiating, it gets split into 2 pathways, which is common myeloid progenitor pathway and the CLP pathway. However, in the beginning of 20th century, it wasn't realized that this model doesn't hold true in all scenarios. And then we land up into something which is called as the myeloid based model. So the multipotent progenitor cells, they split into CMPs plus GMLP. GMLP stands for granulocytic monocytic lymphoid progenitors. So it is this lineage of progenitor cells. It has the potential to differentiate into both the cells of the myeloid series as well as lymphoid series. Now, a few words about hematopoietic stem cells. As hematopoietic stem cells, they lie at the apex of the entire hematopoietic cell differentiation. So they are the primitive cells with the properties of pluripotency. What do we understand by pluripotency? That they can differentiate into the cell of any lineages. Then self renewal, which means they tend to maintain the blood cell formation throughout the life, throughout their life, and then finally the commitment to specific lineages. I'm running fast, I think, because the time is limited, and so please stick to time. That's why I'm just running.
There is not even a second.
So that's why I'm running fast. As now, next is about a few words about the hematopoietic stem cell heterogeneity. So the hematopoietic stem cells, this pool is also heterogeneous. So as we can see that hematopoietic stem cells, they further differentiate into long-term, intermediate term, and short-term hematopoietic stem cells. So long-term hematopoietic stem cells, this remains in our bone marrow, quiescent for 4 to 5 months, and this further differentiates into the cells of megakaryocytic, myeloid, and granulocytic lineages. But the long-term hematopoietic stem cells, they don't have the potential to differentiate into cells of lymphoid lineages. Then this short-term hematopoietic stem cells further differentiate into multipotent progenitor 2, 3, and 4, and then again it differentiates into the cells of various lineages. Now, moving on to the regulation of hematopoiesis. The regulation of hematopoiesis, it is again a very tightly regulated process by several elements of bone marrow, both intrinsic as well as extrinsic. So intrinsic factors are like transcription factors, growth factors, and extrinsic factors are various cytokines. So some of the factors like stem cell factor, lot of interleukins, they are produced in the bone marrow microenvironment itself. Then there are certain growth factors like thrombopoietin and erythropoietin. They are synthesized elsewhere in the body, like thrombopoietin in the liver and erythropoietin in the kidney. And from there, they are transported to the bone marrow, and then this further facilitates the differentiation of the cells of various lineages. So this is a tabular form which is showing some important growth factors and cytokines and their role in the hematopoietic cells differentiation. Now, moving on to the second part of the talk, which is lymphoma pathogenesis. So as we know that lymphomas are a very diverse group of malignancies, and they are characterized by a range of various morphological, very immunophenotypic heterogeneity and clinical features. And this lymphoma genesis, it is driven by genetic alterations from the normal physiological restrictions of growth, differentiation, proliferation, as well as apoptosis. And that's why it is very important to understand the normal lymphoid differentiation to understand the lymphoma pathogenesis. So with this background, the learning objectives will be the overview of lymphoid organs, a normal B cell and T cell differentiation, the overview of B NHL and T NHL pathogenesis, and finally a few words about the Hodgkin's lymphoma pathogenesis. So if we see the lymphoid organ classifications, then it is, as we know that lymphoid organs, they are conventionally classified into two groups: central or primary lymphoid organs, which is our bone marrow and thymus, and the peripheral or secondary lymphoid organs, which is lymph nodes, spleen, and then isolated lymphoid aggregates in the body like MAL, which is mucosa-associated lymphoid tissue, gastric-associated lymphoid tissue, and tonsils. So this is a schematic diagram. Here we can see that in the bone marrow CLPs, now I think we all are aware of this term CLP, this is a common lymphoid progenitor. So this originates in the bone marrow, and the further B cell differentiation takes place in the bone marrow for the B cell. This is which is the primary lymphoid organ. And then for the T cells, the common lymphoid progenitors from here, the CLPs, they migrate to the thymus, and the further T cell differentiation takes place in the thymus. I'll be talking about them in detail one by one. So moving on to the B cell differentiation. So the very first step in the key process in the B cell development is the production of what we call as functional B cell receptor through VDJ recombination. So the VDJ recombination, this is a very important process, and this we need to understand that B cell receptor, it is composed of immunoglobulins and the adjacent transcription site. So the immunoglobulin gene, if we look into the germline configuration of immunoglobulin gene, so it has got 4 segments here. We can see the V segment, which is called as variable segment. Then this is the diversity segment, joining segment, and constant region. So in the first step, in the early B cell maturation, what happens that first the D and G segment recombination takes place, followed by DJ recombination to the V variable segment. Now, after that, what happens when the stage of immature B cell is reached, then this functional immunoglobulin formation, it has been established and it forms a stable BCR. At this stage only, the cells which are B cells which are found to be autoreactive, they are being eliminated by the process of apoptosis, and we call it as the process of negative selection. Now, the positively selected B cells with functional B cell receptors, they become our mature naive B cells, and they at this stage they start expressing surface IgM and surface IgD. So the differential splicing, as we can see that this is the third step. Here is the transcription and splicing occurs, and finally this is the formation of our functional immunoglobulin receptor, B cell receptor. Now, after the formation of mature naive B cells, they leave the bone marrow and they circulate in the peripheral blood as the circulating lymphocytes. Now, so this is the schematic diagram. Here we can see that from the hematopoietic stem cell to the primitive B cell stage, the VDJ recombination occurs. After that, the immature B cell forms with the formation of functional B cell receptor. At this stage, it leaves the bone marrow and reaches the circulation as naive B cell. Now, after then, when it encounters the cognate antigen, then after the activation, it enters the lymph node. This is again a schematic diagram of lymph node, where we can see this is the mantle zone of lymph node, and then this is the dark zone and light zone of the lymph node. Now, what happens then? Activated B cell, when it reaches the dark zone of the lymph node, then here the centroblastic reaction starts, which is characterized by the processes called as somatic hypermutation and class switching. This we will talking in detail. So the next process in the B cell differentiation is what we call as somatic hypermutation. So what is somatic hypermutation? So in the dark zone of the lymph node, what happens is by the somatic hypermutation, there is the introduction of single nucleotide substitutions, which changes the affinity of the B cell receptors. And this process is tightly controlled by the various transcription factors and gene mutations. And the centroblasts which acquire these new mutations, they migrate to the they again migrate to the this light zone of the lymph node, and here this class switch recombination occurs. So class switch recombination, it is again the DNA recombination process. So earlier we have seen that at the naive B cell state, B cell starts expressing the surface IgM and IgD, which is characterized by the expression of constant region mu and constant region delta genes. Now this is by the CSR recombination, this C mu and C delta gene, it is being replaced by C alpha, C epsilon, and C gamma genes, and this leads to the variation in the types of different antibodies. That is, C alpha stands for immunoglobulin A, C epsilon for IgE, and C gamma is for IgG. Now, after multiple cycles of then proliferation, mutation, and positive selection, now the germinal cells or B cells, they differentiate either into the long stem memory B cells or the plasma cells, and they again circulate in the circulation. Now, this is after understanding how the normal B cell develops. Now, in this pictogram, we can see the ontogeny of B cell differentiation with the presence of various surface markers. Now, this is very important for the diagnosis of various lymphomas. So, as we can see that TDT and CD34, they are the primitive B cell markers which are expressed on the primitive stages, followed by CD10, which appears in the early B cell stages from pro B cell to the immature B cell stages. And mature B cells, they are characterized by the presence of CD19 and CD20. CD19, which is assumed to be the pan B cell marker, both CD19 and 20, but they are found to be absent in the few primitive stages of B cell, which is pro B cell and early B cell stages. Now, one important marker is CD38. It is, it's shown here. So CD38, it is expressed in the very early stages of progeny, and then it is disappears, and again it reappears at the plasma cell stage. So this was all about the normal B cell differentiation. Now moving on to the BNHL pathogenesis. So what happens? So this B cell receptor, this VDJ rock recombination, and this B cell receptor repertoire, this rearrangement, it forms the pre-process in the lymphoma pathogenesis. So the three main genetic process which is involved in the development of diversification of this normal B cell receptor, they are implicated in the lymphoma genesis, and they are recombination activating gene RAG mediated VDJ recombination. Then AID, which is activation induced cytidine deaminase mediated somatic hypermutation, and AID mediated class switch recombination. We have already learned about this SHM and CSR. So they are also implicated in.
You have 4 minutes remaining.
So this is a pictogram. So here we can see that AID with the physiologically, what by the somatic hypermutation and class switch recombination, it leads to the diversification of various antibody classes. However, pathophysiologically, if there is any genetic aberration occurs in these steps, it leads to the activation of proto-oncogenes, tumor suppression genes, leading to various mutation, chromosomal rearrangements, and epigenetic modifications, finally leading to lymphomas. These are the various chromosomal translocation, which are again a predominant mechanism in the lymphoma genesis, and they again appears at two different stages, at the pro or pre-B cell translocation. Here we can see, so in the very initial stages, from the pro to pre-B cell transformation, the translocation 14-18 and translocation 11-14 occurs, which is along with the VDJ recombination mediated by RAG1 and RAG2 genes. And T1114, as all of us know, it is the hallmark of mantle cell lymphoma. I'm not going into the detail because in the pathology and molecular pathogenesis, I think we are dealing with them one by one. So I'm not going into the details of this pathway. A very important aspect of the lymphoma pathogenesis is tumor microenvironment. So why tumor microenvironment? It plays a very critical role because it actually it facilitates the escape of lymphoma cells from the immune surveillance. And this is this is very relevant. Why? Because as we can see, these are the tumor microenvironment. It is very heterogeneous. It is comprised of a lot of cells like dendritic cells, mesenchymal stem cells, NK cells, MDSCs, osteoblasts, and all of them at what they do, they promotes the survival of malignant cells and inhibits the apoptosis. Furthermore, what they do, they also modify our immune system, and thus facilitating the survival of the cancer cells. I'm just skipping this slide. Now, so the relevance in the treatment, what happens, just few lines about. So the BCL signaling, as we know, BCL receptor signaling, they are actually the established agents targeting. They are like BTK inhibitors and PI3K isoform specific inhibitors. They are actually targeting this BCR signaling pathways. The second important thing is what we are talking about, the CAR-T, BiTE, everything. These are the immunotherapies, and they are actually targeting the tumor microenvironment, and that's why they are the newer agents, which is what we call as immunotherapy. So this is a pictorial presentation of zonal distribution of various types of BNHL. Now moving on to the T cell differentiation.
I think you'll have to summarize.
I'm just skipping some. So just here in the T cell differentiation, what happens from the early lymphoid precursors. So in the thymus, the early thymic precursor T cell, they come here, and then through the various stages of double negative and double positive T cells, they ultimately lead the peripheral circulation by the process of again beta selection, what we call as a positive and negative selection of cells, and from the double negative stage to double positive stage, and finally they achieve the stage of single positive cells here, along with Treg cells and NKT cells. I'll just skip these slides. So again, notch dependency, like a T cell receptor commitment, it is characterized by notch dependency. And as we can see, I've highlighted all the various transcription factors and genes in the red. So these are all the factors which are mediating the TNHL pathogenesis. I'm sure we will be dealing with them in detail in our molecular discussion. So the pathogenesis of TNHL mainly involves the dysregulation of T cell receptor signaling pathways like B cell receptor in BNHLs, followed by interaction of the non-neoplastic tumor microenvironment and neoplastic transformation induced by various viruses like STLV, and finally cytogenetic and chromosomal abnormalities. This is a pictorial representation where you can see the normal B cell differentiation as well as the cell of origin of the major T cell NHLs. Now, a few words about the Hodgkin's lymphoma pathogenesis. So, the cell of origin of the classical RS cell as well as Hodgkin's cell.
Dr. Nupur, I'm afraid you got to summarize now. Just come to the conclusion slide.
So I'll just skip this slide. So just to summarize, this lymphomas, they are the very diverse group of malignancies and they arise from the mature lymphoid compartment. So the B cell or T cell receptor diversity, it forms the center of the lymphoma pathogenesis, and this also gives an insight into the key oncogenic drivers for specific NHL as well as Hodgkin's lymphoma subtypes for the potential targets for therapeutic intervention. I'll just summarize here.